Welcome to Timebeat Breaking News channel. Here are our breaking news today.
1. COVID-19 vaccination program extended to 30 years old in England. 2. Detecting Indian variants for the first time in many local authority areas.
COVID-19 vaccination program extended to 30 years old in England. The NHS, National Health Service, in England has said, people aged 30 and over can book their COVID-19 jab from Wednesday. About 1 million people aged 30 and 31 will get a text message in the coming days asking them to come forward for their COVID vaccine. To ensure that those at the highest risk are protected from the variant of the virus first identified in India, health officials have sped up the timetable to offer second jabs in a bid. Less than 6 months after Margaret Keenan received the first authorized jab in the world, they are now able to open the offer to everyone in their 30 years old and over. Due to the link between the jab and extremely rare cases of blood clots, vaccination experts have previously advised that people under the age of 40 should receive an alternative vaccine to the Oxford, AstraZeneca jab. NHS leaders in Scotland are encouraging people aged 30 and over to come forward for their jab, and in Northern Ireland, those aged 25 and over are eligible for the vaccine. The government said on Tuesday it would be updating guidance to make it clear that lockdown measures are not being imposed for 8 areas considered to be hotspots for the Indian variant of coronavirus in England.
COVID-19. Detecting Indian variants for the first time in many local authority areas. The variant B16172 was detected in 151 local authorities in the week ending the 15th of May, an 18% weekly increase. The Indian coronavirus variant of concern appears to be spreading rapidly, with 121 local authority areas in England seeing a rise in growth rates. In 37 local authority areas, the Indian variant was detected for the first time in the most recent week for which data is available. Meanwhile, 28 local authority areas that previously identified a case of Indian variant had none in the most recent week. The genome data, where only about half of all cases are sequenced for variants, showed that more than 100 local authorities had fewer than 5 cases of the Indian variant. The latest data from Public Health England also revealed that 3,424 cases in total had been confirmed in the UK until the 19th of May, with a majority detected only in the week prior. The variant is expected to eventually become the dominant form of COVID-19, according to Chief Medical Officer Professor Chris Whitty. Although cases continue to rise in Bolton, Blackburn with Darwin, and Bedford, the 3 areas with the largest number of Indian variant infections, the growth rate for the variant has slowed in the last week compared to the week before. Bolton, Blackburn with Darwin, and Bedford have also seen a sharp rise in COVID-19 infections of all variants in younger age groups since the start of April.
Thank you for watching. We help you stay up to date all the news hourly. Please subscribe our channel to follow up the latest one.